My name is Kevin Little. I'm a health inspector. I work for the health department for the city of San Angelo, and I've worked for the city for about 4.5 years. My primary job function is restaurant inspection. We, as health inspectors, we go around to all the restaurants in the city that have food service permits, and we try to ensure that the food being prepared and presented to the public is as safe as it can be. There's a whole series of rules and regulations controlling what a restaurant can and cannot do, how they prepare food, how they hold food, and we try to ensure, we do our best to make sure they follow the law as closely as they can. There's really no such thing as 100% food safety, but we keep pushing towards that goal. We have around 500 food service permits in the city. There's probably about 350 restaurants. A lot of churches have permits and other facilities, such as the convention center. So with 2 health inspectors, that keeps us quite busy throughout the year. Each permit holder, food service permit holder, is inspected basically on the risk category. If they're serving a great number of people, or they're working with raw fish, raw chicken, raw beef, they're probably going to be inspected 4 times a year at least. Other establishments like a snow cone stand might just be twice a year. As a health inspector, we wear quite a few different hats. We do daycare inspections for the state of Texas. We also inspect foster homes, and then we also go on a wide range of complaints, mainly to hotels and apartment complexes. Bed bugs are becoming a larger issue, unfortunately, in San Angelo. We go to swimming pool complaints, anything that could be construed as a public health risk, we go out and investigate. Taught in public school, as a public school teacher, taught science. And so my degree and my experiences have really led up to this point where there was an easy fit for me to become a health inspector. When I first enter a restaurant, the number one thing I look for is the immediate area where they're doing the majority of food prep. I look to see that the raw ingredients are being handled properly, the proper temperatures, things are being cooked properly, that the big one is cross-contamination, that wherever the raw meats were sitting or where the raw meats were prepared, it's not contacting where the cooked meats are. And then from there, I just branch out. I start there at the core where the cooks are cooking, and then I just kind of go out in a circle around the restaurant looking for all the other issues. Make sure the refrigeration is the proper temperature, any of the steam tables are working properly, and all the other issues regarding the sanitary equipment, the dishwashers, and all the other equipment that's required. There's a huge difference between clean and safe. I've seen some restaurants, kitchens that were extremely clean, but individuals were doing things that were quite dangerous. And then there's as you would imagine, quite a few dirty kitchens. However, the cooks and all the food prep people are handling the foods in such a manner that there's no safety issue. So when it comes to floors, anywhere that's really away from where the food will come in contact, that's less of an importance to us. The most interesting part of the job are just the different places in town I get to go to. I can now say that I've literally been in every kitchen in the city of San Angelo, every restaurant. So just the fluidity of the job and the fact that when I show up each morning, I literally have no idea where I'm going to go that day or what's going to happen that day. I am proud to be a health inspector. I know it's kind of an unsung hero kind of thing. It's enjoyable to be a part of public safety in a very quiet, very small manner that most people don't even think about. But I'm proud to do what I do to keep the people as safe as we can. A good day at work is going out to a restaurant or some facility and seeing something that someone is doing that's not quite safe and they don't realize it, and just informing them what they're doing and why it's wrong and how they could do it better, and having them respond in a manner that they appreciate what I've done. It does happen quite a bit, thankfully, sometimes it's just a very minor, very small thing that they're not doing proper, but they're grateful to see what they're doing incorrectly and how to improve it.